Hey guys, my name is Dawn Gilreath, and I am talking to you today about a client who is a 10-year-old female. Our parents are divorced. They divorced 5 years ago, and she lives with her mother on weekdays and her father on weekends. Medical history is noted for premature birth at 34 weeks. She was delayed on her early milestones, but caught up by age 2. All her other medical history is normal for her age, except for a recent decline in growth trajectory. She has a referral from her primary care physician who is concerned for anxiety that might be affecting her appetite, as she dropped to the 5th percentile for weight for her age just recently. No labs or tests were included from the primary care physician. History of presenting illness. At age 9, she began refusing to eat because she was afraid she might vomit. She eats only small amounts of food, which she stretches over a long time period. She refuses to eat away from home. When at the family dinner table, she plays with her food, and if they try to persuade her to eat more, she cries. Alice remembers an incident when she was 4, where she vomited. Her symptoms have been worsening, and now she will no longer eat in public at all, so she goes all day at school without eating. She denies any concern about her appearance and only became aware of her weight when she visited the doctor. Learning about the dangers of low body weight, she's now become tearful and wants to gain weight. Differential diagnosis for this 10-year-old include anorexia nervosa, which is characterized by an extreme restriction of energy intake, intense fear of gaining weight or becoming fat, and disturbance in the way one's body weight or shape is experienced. So having kind of a body dysmorphia. Anxiety disorder is another possibility. That would be characterized by anxiety that's felt almost all the time and has lasted for over 6 months. And finally, fear of a specific phobia, which involves marked fear of a specific object or situation, almost always includes fear or anxiety out of proportion with the actual danger. Avoidance is persistent, lasting longer than 6 months, and significant distress or impairment, and not more easily explained by another mental illness or physical illness. That is actually my primary diagnosis. Specific phobia of vomiting, also known as emetophobia, is a condition that shares features with several other anxiety disorders, including obsessive compulsive disorder. And approximately half of sufferers from specific phobia of vomiting do not fully benefit from current treatment modalities that we use for them. How would I treat this patient? I would recommend non-pharmacological treatment first. Some approved treatments for phobias are multi-session CBT. You can also do one-session trait treatment specific for emetophobia. And another common treatment is exposure therapy. I don't really think exposure therapy is realistic for this particular phobia, other than you could possibly imagine yourself vomiting, but I don't think that would be a good option for this client. Multi-session CBT has multiple studies that support its use, and I did find one study that found one-session treatment to be just as effective. I think if this were to fail, then I might consider adding an SSRI, like maybe Prozac or sertraline, with plenty of studies showing use in pediatrics. Lifestyle modifications. As far as lifestyle modifications, I would not stress exercise, to lose weight or get in shape, but I would stress exercise out in the open, outside, to help manage stress from the specific phobia. As far as interprofessional collaboration, I think that would be important to collaborate with her therapist, um, so that she gets the best treatment. Thanks so much, and I hope you guys have a great day. Bye bye.